University of California Cooperative Extension and University of California Davis Veterinary Medicine is bringing to you a recording from their March 2023 webinar series. This series was co-hosted by University of California Cooperative Extension advisors Tracy Schohr, Grace Woodmansee, Rebecca Ozeran, and specialist Dr. Gaby Maier. Additional resources from this webinar and other cattle health videos can be found at ucanr/sites/rangelands/cattle health. This session is focused on the mystery of calf abortions with featured speaker Dr. Bret McNabb, a professor, director of the large animal clinic at UC Davis Veterinary Medical Teaching Hospital, and a practicing veterinarian working with commercial cattle producers in the Sacramento region.
Thanks for joining us again today. I hope it's going to be a useful session, certainly something that anyone who runs cattle in California has likely experienced, and a topic that can be somewhat ambiguous in some ways, right? About what is actually the cause of our actual cattle losses or our perceived losses from animals that were previously confirmed pregnant. So abortion can be frustrating and it can be an economic burden on everyone. And so hopefully we can work through some of the ways to think about what's going on and try to get some diagnoses and preventive measures for the future. All right, so what's going on? And so if we're going to start approaching a potential abortion situation, whether it's on the individual animal or looking at the herd overall, we can break this down into a couple of potential causes. The first that I'd like everyone to think about is, what's your baseline? So what's your baseline or background amount of general disease, whether it be foot rot, pneumonia, other reproductive diseases that we're talking about? And what's your background of abortions? If you always have a 90% pregnancy rate every year and every cow always calves as she should, that's a good baseline to then compare to. Because if we're worried about deviation from normal, and if we're worried about an epidemic or an abortion storm, we need to be able to compare back to something. So knowing what already exists in the herd is an excellent place to start. And then we can start to ask, I'm going to go through 4 questions here that we'll sort of touch on throughout the evening. One, is there just normal unavoidable disease in the herd that we just have accepted as part of where the pastures are, where the summer land is, what our calving corrals or barn looks like? Are there just some things that are unavoidable given the resources that we have available to us? Are there losses that occur chronically and consistently, meaning every year we have the same 3 or 4 calves that die because of this, or every year one cow aborts a mid-gestation, mid-pregnancy fetus? Is there an epidemic going on? So is there a surge beyond what we expect or what we've experienced previously in the herd that we need to investigate quickly? We often call this an abortion storm in the case of many animals having abortions in a very short period of time. This is, of course, what often gets people's attention if you're unfortunate enough to have something like this happening. And the other thing to keep in the back of your mind is, are we really seeing abortions? Or are we confusing abortions with an infertility problem where cows and heifers just aren't getting pregnant in the first place? Or are we confusing it with neonatal losses? So we're having cows and heifers go all the way to term, calve, but then we're having calf deaths very soon after they're born. So as we go through these different things, we can really think about how to tease out different details that can help us start going down the line. Because as you'll see, well, there are a lot of things that can cause abortion. And it's not always the easiest thing to get a concrete diagnosis for one or even multiple abortions happening. So anything we can do to help fine-tune our look is going to be quite useful. So what I like to remind people of to start is, ask yourself if there's a problem or not. And this might seem like a very simple question, but it might not be as straightforward as you think. So are we having a problem that we can relate all these different experiences back to one common issue? Or are we just having a bad coincidence? Are there just a bunch of unrelated things that are all happening at the same time. We had a calf die from pneumonia. We had a cow abort. We had another one get a bad case of pink eye. We had another one fall in the canyon and die. Those are all likely unrelated events. But if there are things that are more uniform, we might start to put them together into one overall problem. Are the cows getting pregnant? So this goes back to our bull power and the ability of the bulls to find cows and get them pregnant. But it's an important starting point. If we're not getting cows pregnant in the first place, is it that they're just not getting pregnant, or are they getting pregnant and then having very early pregnancy losses that happen before we even know that they're happening? So that we do this by diagnosing pregnancy, whether it's with rectal palpation or ultrasound or blood-based tests that you might be using. Any of these are going to be helpful to give us that, again, baseline data as to who's pregnant as soon as we can figure that out. Are the cows continuing to cycle throughout the entire breeding season? I'll show you a couple of charts in just a second, but we typically expect, hope that 2/3 of the cows will breed up in their first cycle in with the bull, and then over the next 2 to 3 cycles, we'll have the remainder of the herd breed up. If we're seeing a lot of the cows cycling, so we see a lot of active breeding across the whole herd during the entire breeding season, then that might suggest to us that they're breeding back over and over again because they're not settling. And again, are they conceiving and then losing an early pregnancy, conceiving, losing an early pregnancy, or are they just not conceiving at all? Not the easiest question to answer. And like I said, are we confirming them pregnant? So are they staying pregnant until we do preg checks, whether that's at anywhere from 30 days to 6 months? It's going to really depend on your management strategy as to when we're diagnosing pregnancy. But are we having a loss after that? By narrowing down this window of pregnancy, we can really start to bring likely causes to the forefront and really push others that are less likely to occur at that spot of pregnancy lower on our list. When during pregnancy are those pregnancy losses? If we're having those losses, does the fetus look normal? And does the placenta look normal? Or are they abnormal? Are we having congenital defects? Or are we having really thickened, almost like leather-looking placenta that might be suggestive of certain types of abortion causes? And then one more thing, if we're seeing stillbirths or fully developed calves that are being aborted right before they're expected to calve, was it alive when it was delivered, or was it born dead? Looking at a calf, whether it wore off the cushions on its hooves, like it stood up to walk and then died, whether its lungs were ever inflated with air, those sort of things can help us, again, pinpoint whether it was alive or dead at the time that it was delivered. Okay, so those questions in mind, let's start to look at some expected normals, and then we can look at some expected abnormals. So like I said, we often expect the majority of cows to breed up in the early part of the breeding season and just have the stragglers left over at the end. And so if you look at a histogram or a graph like this, we can look at this as either a breeding window or a calving window, right? Because they should mimic each other just at different points of the year. So if we think that most cattle are going to be bred by the time they've cycled 3 times or had 3 21-day cycles in the herd, we'll expect a few to be open at the end because, of course, it's very rare that we get 100% pregnancy rates in most herds. So if we keep this as the expected normal, we can look for deviations from this to define abnormal on the herd level. So here, might be an example of cows that were not all conceiving at the very beginning of the breeding window and had a prolonged breeding session. So we can see that this is, again, the percent of cows that are getting pregnant every 21 days when they're in with fertile bulls. If we have this distribution spread more out like this, we really can wonder, why aren't all the cows conceiving in those first 1 or 2 cycles in? Are they not at a good body condition? Do the bulls have fertility issues? Are the cows not cycling yet? Or do we have inherent disease that's either preventing them from holding a pregnancy after they've bred, or where they're having all these early losses and then conceiving again later in the season? Either way, we're having a higher percentage of opens than we really care to. Then we can look at dramatic changes, either again, based on when we're diagnosing pregnancy and staging pregnancies, or looking at your calving window to say, okay, now I've had cows that were breeding up at the beginning of the breeding season and doing what they should. But then all of a sudden there was an event that happened. I'm not sure what it was, but now I have more open cows than pregnant cows when I come to preg check, or even worse when you come to calving and don't know that or expect this yet. And then we have a pretty bad situation on our hands. It's going to be pretty hard for that season to recover from. But doing this can really start to prioritize things in terms of diseases. So if we break up pregnancy a bit, let's kind of go through a timeline of what events happen during pregnancy, because that's going to help you think about what might be going on when you lose a pregnancy at those different stages of pregnancy. So we divide pregnancy up into two basic periods. We have the embryonic window and the fetal window. So after conception occurs, we have that little embryo moving down the oviduct and coming into the uterus. And then it's going to start to develop and grow until it hits the fetal window. Now, during that embryonic time, it can be a sensitive and delicate time for that embryo during development. This is where we see the most genetic and chromosomal abnormalities manifest and cause termination of pregnancy. We also see heat stress play a factor in the early embryonic period. So if it's really hot or the cow has a fever or anything else there, the first 6 to 7 days of pregnancy are extremely critical for heat stress. We then get into the late embryonic period, which is going to happen after the cow would have naturally cycled back if she wasn't pregnant, where again, we're having final organ development within that little embryo. And about day 42 in cattle is when all those organs are completely and fully developed in their own respect. So all those cells have gone where they are, and we have what's recognizable as a very small fetus. So we're going to call a conceptus a fetus after day 42 when it is fully differentiated and ready to start growing. The reason we make this distinction is because there are certain diseases that target embryos and certain diseases that will target fetuses and certain diseases that will target both but act differently. So a couple of good examples of embryonic loss, so loss of a pregnancy before day 42, would be things like Vibrio, Campylobacter, and Trick. Two classic examples of what can happen in the early and mid to late embryonic periods. Most of the other diseases we're going to talk about happen in the fetal period. So after we have a developed fetus growing, can have different implications for how that pregnancy is targeted. And it's been estimated that well over 40% of pregnancy losses that occur in cattle do so as embryonic losses. And many of those are non-infectious, genetically based chromosomal issues during development that were either lethal mutations or lethal developments that weren't going to end in a viable fetus and a viable calf. So it's basically nature's way of taking care of a mistake and starting over. And many of those we never recognize as being pregnant in the first place because they even happen in the first 10 to 12 days of pregnancy. After that, in the late embryonic period, we maybe have 6 or 7% of our losses there. And once we get into the fetuses part of pregnancy, we have relatively few non-infectious losses. And so you can see, if we look at the pregnancy rate that's on this graph here, our pregnancy rate for that herd stabilizes as we get beyond 35 to 40 days of pregnancy. As we progress, we like to think about how that fetus is being supported in the uterus as it develops. So this is a nice schematic of a calf being developed within the placenta that sits in the uterus. So as you can see, let me just put my pointer. Okay, so this is an actual picture of the placenta and then the schematic. So we have the fetus developing here. It's surrounded by the amniotic membrane. So that's what's going to be the second bubble that we see during calving. So it's going to be cushioning and supporting the fetus from a lot of concussion within the cow during its entire pregnancy. And then we have the rest of the chorioallantoic membrane that goes over here as the layer of the placenta that's going to form those buttons. So those cotyledons, they're going to attach to the caruncles of the uterus and allow for all that oxygen and nutrient exchange during pregnancy. We have all the maternal nutrients and oxygen coming through those placentomes, going into this blood supply and going right into the umbilical cord of the calf and going right into its internal organs, going around the fetus and then coming right back out. So you can see how when we think about different types of abortion, we can see how different bacteria, viruses, protozoa are going to attack different parts of this fetal placental unit. So we have some things that might go and attack the fetal liver or the fetus itself. We have other things that are going to target the placenta and basically cause enough inflammation in the placenta to not allow that normal oxygen and nutrient exchange and basically kill the fetus through starvation or a lack of oxygen. So when we're looking at a fetus and a placenta when they've aborted, this is a nice example of a healthy, normal placenta. We have all the buttons or all the cotyledons that we can see here. And we can see in between there, it's a relatively thin and clear structure. So we can actually see through the region of the placenta in between those buttons and see the fetus in between. If this was what we call placentitis or an inflammation and infection of the placenta, then not only would these attachments be thick and discolored and sometimes mineralized, like little, almost like salt and pepper appearances if there's calcium deposits and things, but that entire clear area would be very thick, opaque, white, may even be covered in fibrin and various other things. That would be a very unhealthy placenta. So the starting point that we can look at there. So the big question, what causes abortion? A lot of things. And so this is but not an exhaustive list by any means, and we're not going to talk about all these in detail tonight, but I want to give you just a global picture of what is happening. On the infectious side, we have different bacteria, viruses, protozoa, and fungus that will cause abortion in cattle. So some of the more common bacterial causes that we see would be foothill abortion, leptospirosis, and Vibrio or Campylobacter in cattle. We see many other species of bacteria that can cause sporadic abortions, but on a much smaller scale. Things like Q fever or Salmonella or Listeria are things that we'll see come up on diagnostic reports on occasion, but they're not the leading causes that we see. On the viral side, the two more common things that we worry about are BVD, bovine virus diarrhea, and IBR. On the protozoa side, things like Trichomonas fetus or TRIC will be a potential cause of embryonic losses. And then Neospora, which is another protozoa that is not insignificant in California. And then we'll see fungal issues. On the non-infectious side, again, these can happen anywhere throughout pregnancy. We may see genetic or developmental issues. And again, the genetic and chromosomal abnormalities most commonly happen in that early embryonic period where we'll have those losses. And we may never even know that the cow was pregnant to begin with. Toxic plants like lupine, pine needles, locoweed, and a host of other toxic plants can certainly cause mid to late pregnancy abortions and calf abnormalities. We'll see things like nitrates in exposure that can cause not only death of the cow, but can also cause a low oxygen and abortion in the cows that survive. We often talk about low nutrition and trace mineral imbalances like copper and selenium and things. And while those certainly can have an effect on the fetus, they're relatively uncommon as a sole cause of abortion. It can certainly happen, but it's not a leading cause of our abortion. And I already mentioned heat stress, in the first 6 to 7 days post-conception, when that embryo is in the oviduct moving down into the uterus, that's a pretty delicate time for that embryo. And if the cow has a fever or it's 110 degrees outside and she's stressed because of that, that can lead to embryonic losses. Okay, so how do we diagnose this? So when we have an abortion, ideally we're going to try and isolate that cow from the rest of the herd if possible. I know that's not always possible depending on when it's happening. But if it's contagious and infectious, we want to prevent the spread from her to the rest of her herd mates that are hopefully still carrying healthy pregnancies. We're going to collect the fetus and the placenta. So a couple key tips here. If we're able to collect them, you really want to avoid freezing the placenta and the fetus. So if they're in the dirt or in straw or shavings or wherever they are, try to avoid the urge to wash it off too much because we don't want to damage or ruin any diagnostic potential that we might have there. And avoid freezing it. When we go to do a necropsy on a fetus or a placenta, we're going to take sections of it, do staining, and look at it under the microscope. And so what freezing does is it causes ice crystals to form throughout the tissue, and it actually ruins all the architecture of the cells. So we lose the ability to do what we call histopathology, or look at the tissues microscopically. So refrigeration only, and ideally getting into the diagnostic lab or to your vet as soon as possible. Because every hour that goes by, that fetus starts to decompose more and more and has the potential to become less diagnostic. But if you can refrigerate them and get them in within 24 hours, that's going to be ideal. We'll also collect blood from the cow if possible. We're going to take a red top tube of blood and use that to look for antibodies. So we're going to see if she's had an unusual response to a disease that causes abortion, and if she has unusually high antibodies to that. If possible, one of the best things you can do is to also sample blood from another unaffected cow. The reason for this is that we have a lot of background interference with antibodies. And if the herd is well vaccinated for the diseases that we're looking at, then it can be hard to tell background vaccine antibodies from antibodies that are indicative of disease. So if we can compare an affected cow and an unaffected cow, that actually gives us some ability to differentiate what might be background noise from antibodies versus what's really happening in this case of abortion. So we'll try to submit samples to the lab or to your vet, and then work with your vet on the diagnosis and herd health implications. So how you're going to change it based on the diagnosis that you have. And then continue to monitor the rest of the herd for abortions. So I mentioned the samples here, but this is really the trifecta of sampling for abortion workup. The fetus itself, placenta, and it doesn't have to be the whole placenta. It can be a section of placenta, as long as you're getting those cotyledons and getting some of that other space in between those cotyledons. And a red top tube from the cow's blood. By doing this, they can have the best chance to rule in or rule out certain infectious causes of disease. So fetus, placenta, and cow blood. So we do routinely use the CAFS lab, so the California Animal Health and Food Safety Lab. Again, the closest lab for everyone in Northern California is the one here in Davis on campus that's right next to the vet school. I'll say that they have an excellent lab system, and they do a great job at working up livestock abortion. It's one of the biggest reasons that animals get submitted to the lab. So for a cost basis, if we're doing a full necropsy on a dead adult animal, it's $135 for almost all tests included. And if we're doing an abortion workup, you can submit 3 fetuses or 3 young calves that are less than 3 months old under the same accession for the same price. And that's going to include 3 fetuses, 3 placentas, 3 blood samples from their 3 cows that lost the calves. This is an amazing deal. It's subsidized by the state through CDFA and the School of Vet Med. And so you get a lot of information for $135 here. So I know it's hard to get samples in depending on where you are, but it can be valuable information if you're having a problem in the herd. And so we'll rely on the results we get from here to make herd recommendations on preventive measures, vaccine changes, that sort of thing. And they do a great job on their workups. They actually published a review of their work a few years ago, looking at what was diagnosed in terms of bovine abortion in California. And if we look, they are able to identify infectious agents in about 47% of submissions. They could identify that there was an infectious cause, but they couldn't tell what it was in another 12. And then you can see the rest there in terms of no specific lesions or no specific diagnosis being rendered. And so I want to show this because it's important to remember that we're not always going to get an answer for the cause of abortion. And on the surface, that can be very frustrating, especially if we are having a problem and we've submitted a calf and placenta to the lab. But as you'll see, some of the different diseases we're going to talk about might infect the animal and then cause their effects many days, weeks, or months later. Others may be very evasive in terms of diagnostic testing. So it's not always the easiest thing. But what is important is what we can rule out and what's the fetus or placenta are negative for, and what other issues we find along with the submission. So I encourage people to always submit and submit multiples when possible to try and give us the best chance of getting a diagnosis. So back to our fetus and placenta in the cow. How do these diseases get there in the first place? There are two basic approaches, right? It's bloodborne. So the most common route in cattle is going to have blood bacteria, blood fungus, that's going to be coming in from the rumen, right? Probably crossing the rumen wall, or it's being inhaled by the cow and getting into the blood system that way, spreads through, and then goes to the fetus, across the placenta, in through the blood supply to the internal organs, or into the amniotic fluid there. We can also see it ascending up from the cervix or vagina. So in the case of, again, fungal issues and occasionally trick or other rare bacteria that can happen, they can actually work through the cervix and get in there. Relatively uncommon because the cow's cervix is held so tightly closed during pregnancy, but it is a possibility. And what really happens, like I said, either crosses the placenta or it infects the amniotic fluid that then affects the fetus and however it's going to happen. So this is where we're going to look for placental changes or fetal changes when we're doing our investigation. Most of the time, an aborted fetus is going to be expelled along with the placenta. It might happen right away. It might happen a while later after fetal death, but most of the time that's going to be the outcome. We may or may not have a retained placenta along with that, again, just because the normal hormonal cascade of calving has been disrupted because this pregnancy has been terminated. But there are some other outcomes if it's not passed. So one would be a mummified fetus, where we have some kind of sterile death. So there's not a bacterial component to this abortion, and the fetus simply stays in the cow's uterus. The cervix doesn't open, but the fluid that's there is slowly reabsorbed. So we're basically drying out this fetus, which is why it's termed a mummy. The corpus luteum that's maintaining the pregnancy on the cow's ovary stays, and so we keep this progesterone dominant state that's keeping the cervix closed and making the cow think that she's still pregnant. This is maybe only 2 to 3% of abortion cases that this happens in, but it happens enough that we should mention it. Often there's minimal uterine damage, although as more and more fluid is resorbed, that lining of the uterus likes to shrink around, almost like shrink wrap around this fetus. So if it's too chronic, it can actually become very sticky and it can be hard to expel later on. If we're able to expel that fetus later on, she has probably a guarded prognosis for returning to fertility because of the potential impacts on that endometrium or the lining of the uterus and future fertility. And unfortunately, we see some things like Neospora cause this and the occasional viral component, but many times these have an unidentified cause, and they're not always necessarily infectious. The one thing we can say is that it's not bacterial, because bacterial infections are going to show, or either going to cause expulsion of the fetus or cause what we call as a macerated fetus. So again, a macerated fetus is where we have fetal death. We may or may not have partial mummification, but we're also having bacterial contamination, whether it's because the cervix is open and it's coming up from the vagina into the uterus, or it's coming in through the placenta and causing this. And what happens here is that we have basically the bacteria infecting and causing the fetus just to rot and decompose in the uterus. And so we see it completely fall apart. So we might see bones or fragments of bones floating free in the uterus. And this is where we get some potential damage happening to the reproductive tract. Occasionally we can pull the pieces out and salvage the cow, but many times we've had irreversible damage to the uterus, so we don't recommend breeding them after that. So again, relatively uncommon, but something that we should mention, that not every fetus will pass. So we're some bacterial causes. So again, one of the most common diagnosed at calves and one of the most common causes that we see in Northern California would be foothill abortion, or EBA, or epizootic bovine abortion. Many folks are going to be familiar with this, right? Caused by Pahoilobacter abortibovis. So again, rolls right off the tongue, but named after the tick that carries the bacteria that's plagued us for over 100 years. Very classically causing late-term abortion and weak calves to be born. So we know there's a window of susceptibility during pregnancy, very classically between 60 to 140 days during pregnancy. But the sweet spot, if you really look at when most cows are most susceptible, it's going to be about 100 to 110 days. So that's about 3.5 months along in pregnancy when the cow is exposed to the tick that has enough bacteria to start causing problems. But as you know, it's a very unusual bacteria. It's going to have a delay in the fetal effects. So it's a very slow growing intracellular, so it lives in the cells, and it takes well over 100 days to start causing effects on the fetus. So we know that if a cow is exposed really before month 6 of pregnancy, there's a good chance that she will abort in the last month of pregnancy because of foothill abortion, if she's never seen it before. If the cow is exposed after month 6 of gestation, there's a good chance that she will be able to carry that calf to term and calve because the bacteria wouldn't have had enough time to cause any effects. When they're infected right around the 6-month mark, that's where we start to see this gray zone, and we can see these weak calves that are born as a result of foothill that didn't quite kill the calf in the uterus, but it weakened them significantly. And it makes up about 1/3 of the diagnosed abortion cases in California. So we know the mortality, in naive heifers is quite high, and it can get up to 90-95% of the naive herd causing abortions, which is just devastating, I know, to everyone who's been dealing with this for so long. And so it's carried by the pajuelo tick, which is a soft tick, relatively big tick, right? It's not a small thing by any means. And it's a deer tick. So it likes to live in the deer duff and the deer bedding grounds in sort of arid areas. So it likes the brush along creeks, and it's again a fairly regional tick. And you can see on the map here where it's been captured and documented to live naturally throughout California, northern Nevada, southern Oregon, and even through Mexico. We're now starting to see foothill abortion in Arizona and southern Idaho, and we're really suspicious as to whether there might be even some happening in western and central Utah. Most likely it's been happening for a long time, just never recognized because it's such an unusual disease. These ticks are pretty interesting. They're pretty odd. They're very rapid feeders. So they only stay on the cow for about 15 to 20 minutes to get a blood meal and then drop back off into the bedding. And so for as short a time as they're on the cow, they can cause significant damage. And they're most active during the summer, right? So mid to late summer, early fall is when they're really going to be the most active, the hungriest, looking for the most blood meals, and where we have most of our exposure happening. So I know we had some questions before the session started about what's happening along the Oregon, California border. And while we are seeing some cases diagnosed, it's certainly not the most commonly diagnosed area in terms of the diagnostic lab. There may be cases happening that we're just seeing in the field, that aren't coming through either on blood work or on necropsy submissions. But it's not the most active place, even though we know it exists up there. So for the longest time, it was diagnosed just with gross pathology. So it causes some very characteristic signs in these calves. And so it's typically a fresh fetus that's expelled, meaning it doesn't die and then sit in the uterus for a long period of time. It's going to die and then be kicked out by the cow. We'll see internal organs like the thymus and the spleen be affected. We'll see enlarged lymph nodes throughout the fetus, an enlarged spleen in the fetus, and all other sorts of what we call lymph effects, looking at the necropsy. We'll also see a lot of ascites or free fluid in the abdomen. And again, until we had a PCR test to look for DNA for this bacteria, this was always diagnosed simply based on the appearance of the calf and by the region that the heifer would have been in. So we now have serology, so we can take blood samples from cows to look to see if they've been exposed. We'll also be able to diagnose it not only on clinical findings, but also on finding the DNA of bacteria, so using a PCR there. There is no treatment. For the longest time, we've tried to manage around it by fall calving, thereby exposing late pregnancy cows and heifers to the tick when it's most active, trying to reduce the effects on that pregnancy. But as you know, as of a few years ago, we now have a commercial live vaccine that Dr. Stott and his lab worked many years on developing. So it's a veterinarian administered vaccine that can be given once, at least 90 days before heifers are due to be bred. That is virtually 100% efficacious. So there aren't many vaccines that we can say have 100% effectiveness, but this is one, because we're basically giving that heifer a controlled infection of this bacteria before we expect her to see it in nature. This vaccine was a joint effort between UC Davis and the California Cattlemen's Association to bring it to fruition. And so I think it's going to really change how we approach foothill going forward. So again, something that we commonly see, again, exposure early and mid-pregnancy, but not having its effects until late pregnancy. So if you're having early pregnancy losses, it's not going to be because of foothill abortion. Another bacteria that we occasionally see would be Vibrio. So Vibrio is just a common term that we use for Campylobacter fetus venerealis, which is a very specific strain of the Campylobacter bacteria. There are many, many, many Campylobacter species that will cause some GI issues, some food safety issues if our food is contaminated with it, will cause abortion in sheep and goats. But this one is the particular one that we're worried about in cattle. And it acts in a lot of ways like trick. The bull is the carrier, so it carries this bacteria on the surface of his penis and prepuce. He breeds a cow, she's temporarily infected, but conception still occurs. So with Campylobacter and trick both, we have conception, we have an embryo, but then because of the cow's immune response to this bacteria being present in the uterus, it's that immune response that actually kills the embryo. Most commonly, we'll have embryonic losses, occasionally early fetal losses, so in that 40 to 60 days of pregnancy range, but we'll also occasionally see the mid-term abortion, so anywhere from 4 to 7 months of pregnancy. But many times it's going to be in that earlier window. This is a problem because many times this is not discovered until preg check, when a bunch of cows might be open. Or in the case of the graph on the left here, we might have scattered gestational ages, meaning they might have conceived, lost the pregnancy, but then had some immunity because she's now mounted an immune response to the bacteria. So she breeds back to that same bull, has the same exposure, but now her immune system can fight it off and the pregnancy sticks and carries to term. So if you're seeing a really wide distribution of pregnancy ages or a really wide distribution of calving dates, this might be something to consider. So again, cows develop immunity, they clear the infection entirely, and they often have an an immunity that lasts 1 to 2 years, and before it starts to wane and go away. So if you're not vaccinating for Vibrio, you might see over the course of many years, your pregnancy rates ebb and flow, because you might see years where you have a good immune response and the cows can fight off the infection. Other years you might not. So we do have vaccines available, either standalone or combination vaccines, that in general do a pretty good job. We have these oil-based vaccines like Vibrin right here, where they'll evoke a pretty strong immune response in the cow or the heifer, and they're also labeled to give to bulls. What's even labeled as we can give a double dose of this vaccine 4 weeks apart in young bulls, and it's been shown to clear the infection in the bulls if they're carrying the bacteria. The other combination vaccines, like you can see here in VirusShield 6VL5, will incorporate it into a multivalent vaccine. A little bit less potent and less reactive than the oil-based ones, but they still overall do a pretty good job. And I should have said this at the beginning. I do not have any commercial ties to any vaccine company, so I'm not here to promote any type of vaccine. So I've tried to represent different manufacturers throughout this talk with examples. But reading vaccine bottles can be confusing. So if you take a look here, it does list every component in the vaccine. So you can see here that this one has Campylobacter fetus, which is the Campylobacter that we're concerned about. And most of them that contain this will have a V in the name of the product. So VirusShield 6 VL5, it's going to be a Vibrio-containing vaccine. And I really recommend that all beef cattle and beef bulls be vaccinated for Vibrio every year, because it's a bacteria that's very common in California. And honestly, I don't have good numbers to tell you how much infection we have with it, likely because we have a lot of vaccination happening up and down the state. So we don't see this as a big clinical concern. And so it's something that we're going to go incorporate into our normal vaccination protocols. Another one you'll see, like if you're grazing on pastures that are irrigated or along lakes or streams or riverbeds, will likely be leptospirosis. So it's what we call a spirochete. So it's a kind of a corkscrew-like bacteria that causes problems in all species. When we see it happen in cattle, it basically causes two things. It causes kidney infection and disease, or causes reproductive effects. Now, leptospirosis can be a confusing thing. And I only put up all these different serovar names to drive home that point, and hopefully I've done that. But basically, we can break down all these different sub-serovars and species of leptospirosis into two basic categories. One would be a host-adapted strain, meaning that when cattle get these host-adapted serovars, they can range from either no symptoms to relatively non-specific infertility issues. And those are going to be the Harjo serovars. So you'll often hear these discussed in terms of Harjo progitino, or Harjo bovis, which are right here. Harjo bovis is the cattle host-adapted strain that we see most commonly in the United States. And that's the one that we're going to talk about when we talk about Harjo. The non-host adapted serovars are from other species. So whether it's most commonly wildlife, wild pigs, sometimes dogs, most of the time it's various wildlife species that are shedding these because they're their own host-adapted strains. But now it gets into the cattle that aren't used to it, and it can cause these big abortion storms or a high incidence of abortion. So the two that we get most concerned about in California, again, are Harjo bovis and the Pomona strain of the non-host adapted. So we're going to make sure that our vaccines hopefully contain those. And when we think about leptospirosis, it's really thinking about the control of the disease, not so much eradication, not so much mass treatment. So like I said, many times we see them infect kidneys and the urinary tract, often mild infections, sometimes very severe, depending on the cow and the load of lepto that she's getting. It really causes this damage to all these blood vessels in the cow and in her urinary tract that can lead to some long-standing damage. But the kicker here is that after she clears the infection, she's going to shed it in her urine for weeks, if not months, and be a potential source for other cows to come in contact with it. In dairies, we see it as a problem because if a few cows are shedding it, those cows are held so in such small areas, right? Because they're intensively managed and they have a fairly wet environment that they're all being exposed. But the same thing will happen with beef cattle out on pasture or on irrigated lands. So once it's a cow is exposed, it can cause the renal and kidney issues. It can also live in the reproductive tract for, again, weeks or months. In the cases where it's living in for a few weeks, this might be causing some infertility issues. So whether the cow does not conceive or conceives and has an early embryonic loss because of local inflammation, it's really hard to say. But we can also see more significant impacts on pregnant cows where we're having mid to late pregnancy abortions. And again, sources are other cattle, wildlife, and standing water that might just be a nice pooling area for lepto to be. So something that we do see from time to time in beef cattle, typically, again, if we're seeing infertility issues or perceived infertility issues, it's going to be those Harjo-bovis strains. And if we're seeing big abortion storms, it's going to be those non-host adapted serovars. So we have a lot of vaccines available. Many of these are going to be used once or even twice a year in extreme cases. But you'll see that most of these vaccines have an L in their name. So an L and then how many serovars of leptospirosis are included. Most of the time, that's going to be 5. And again, you can take a look and see which serovars are included when you look at each of these. Okay, it can be overwhelming to read a vaccine bottle, but you can see that they're containing most of the common ones. So again, most of these have Pomona that we're worried about causing mid-term abortions. Some of them now are including Harjo-bovis. So like Triangle 10 HB, the HB is showing that it's actually including Harjo there, which can be very helpful. Environmental management is almost impossible, so we really rely on maintaining good vaccination for leptospirosis. Another bacteria that luckily we don't see anymore in California and really only see occasionally around Yellowstone would be brucellosis, right? But a very classic example of a bacterial infection. This bacteria has basically targets certain sugars that live in the cow's placenta. So they're almost set up to fail when they are exposed to brucellosis. Most commonly, they're aborting mid to late gestation, causes retained placenta, causes a uterine infection or metritis, and then they like to shed that bacteria for multiple weeks and infect everybody else. Something that's also highly zoonotic, right? So very contagious to humans if we were exposed to it. But very classically, if you look at this placenta, this is what a bacterial infection placenta often looks like. So we're going to have thickening and inflammation of the cotyledons. They're all discolored. And we start to see this, what we call the intercotyledonary region, or all this space between those cotyledons that's normally nice and clear, become thick, white, and opaque. Some people have described it as leather or like a Moroccan leather appearance. But it's going to be kind of thick and nasty. We'll also see signs in the fetus. They'll often see a fetal pneumonia and other fetal changes. But luckily, California has been brucella-free since 1997. And as you know, we have a really strong federal eradication program that's existed since the 30s to vaccinate cattle. And of course, now our regulations have changed in California, so that's not going to be required anymore, but still highly recommended for in-state cattle. Okay. Switching gears to protozoal causes. 2 main ones to target are going to be Neospora and Trick, which we see in California considerably. The first one is Neospora caninum, or just Neospora, which makes up about 20% of the diagnosed infectious causes of abortion in California cattle. it's an interesting life cycle. So dogs are the main host. Dogs are going to defecate, shed these oocysts, which are the neospora. Cows come in contact with them and then have all these different manifestations of disease. Most commonly, it's going to be abortion in cattle. But really, once the cow ingests those, they tend to spread to all tissues through the blood. And then it depends on where they really lodge that they cause issues. But what they are basically targeting both the fetus and the placenta and causing fetal death mid-gestation. One of the controls of this is often discussed as controlling dogs. And that's not that easy, I know, especially when we're talking about wild dogs like coyotes. They're going to be moving through and could very well be a reservoir for this. We'll also see a cow that aborts. Another cow might come over because she's curious and sniff and lick the fetus and placenta and be exposed that way. So that horizontal transmission. So the most common way we see the spread, though, is what we call vertical transmission. So it's where the cow is infected and it passes across the placenta into the calf. Now, what's confusing about this disease is that that calf may abort, or that calf may be perfectly normal and be born and go on to live a normal life. So just because they're infected doesn't necessarily mean it's a death sentence. When we see horizontal transmission from one cow to the next, it's actually less common than that in utero transmission, but it has the same outcomes, right? The first time a cow is exposed, she is more likely to abort. But when she is infected, then her calf in subsequent years may be affected and abort, or it may just be a carrier and live and go on to have a normal healthy life. Very commonly, they're going to be mid-pregnancy abortions. So again, 5 to 6 months of pregnancy. And we'll see them pass a fetus. We'll also see neospora result in mummification, probably more commonly than other causes. So if we're going in because she hasn't calved and we're palpating her to see what's wrong, we might actually be able to palpate a hard mummified fetus in her uterus. And based on the size of it, we might estimate when that fetus died during pregnancy. Again, with prevention and control, there used to be a vaccine available, but it wasn't very good, to be honest. And it's been off the market for 9 or 10 years now, so it's not available. Really, it's going to be trying to mitigate dogs and wild dogs, if at all possible. And again, avoiding cows that have not aborted or not calved yet, coming in too much contact with other placentas and other aborted calves when possible. I see there's a couple questions here, but I'll try to target real quick. So the first question, for leptospirosis, should cattle be vaccinated prior to breeding and then boosted about the 4th month of pregnancy? That's a good question. Certainly they should be boosted before pregnancy. And we'll talk a bit about it at the end about trying to vaccinate and get that animal exposed and ready to attack that bacteria, virus, whatever, before we expect them to come in contact with it. And so that's often good enough for what we're doing. However, if you've had problems with leptospirosis, then yes, they can safely be boosted mid-gestation with another product. So it is safe to do that. Usually manufacturers will have that on their label that it's okay to do. But if you are having problems, then that'd be something to add on to your vaccination strategy. Is it good or bad to change your vaccination? So example, Virus Shield to the triangle to include wider coverage. It's a good question. I like to take a cautious approach. So I don't like to advocate that anyone change anything if you think it's working for you, because I don't want to be blamed when something happens the following year. But if something is not working and you have diagnosed losses or you have concerns, then we should look at what risks are there and what to do. So I wouldn't just give a blanket recommendation to change vaccines because the one you're using might work for you. Virus Shield VL includes Vibrio, and it's a good array of our most common causes. Triangle 10 does include the Harjo bovis strain of leptospirosis, but if you're not having problems with that, it's hard to justify changing. And then last, when you have a cow that you confirm pregnant, then aborted and no fetus is found. Okay, I'm going to read this first. Okay, so if you have a confirmed pregnancy that then aborts, don't find the fetus, can a blood sample from the cow tell us what caused the abortion? Yes, it can help. So if you have nothing else to go on, then that's great. But if you've been vaccinating for some of the diseases we're talking about, that cow should have antibodies to a lot of those diseases already. So you might get what we call titers, or antibody levels we can measure in the blood. But without comparing that to another unaffected cow, it might not be that helpful. So a one-time blood sample without anything else to go on, unless you know that you don't vaccinate for anything. So if you're a completely naive herd, no vaccinations, then we know that anything we find would be significant. And even if you don't have the fetus, if you have a little bit of placenta in the blood, then that's better as well, because so many of our pathogens will actually target the placenta. So Neospora certainly is a concern for us in beef cattle. The other protozoa that's very commonly discussed, of course, is Trichomonas fetus, or trick. We've been doing a very good job of reducing the incidence of trick in California. If you look at 1989, when we first started documenting it, to the most recent numbers I have here are 2021, where we had 1/5 of 1% of bulls that were tested come back positive. So again, we often think of this as a venereal disease of bulls, which it is, but we're going to talk about the female aspect of it here. So again, disruption of very early to mid-gestation pregnancy, no signs of disease in the cow other than this, and venereal transmission. It really doesn't spread any other way. The bull carries it but doesn't show any symptoms, lives on the surface of the penis and the prepuce, just like Vibrio, very effectively spread during breeding to cause the problems. Something to note though, it's not the only trichomonad in cattle, but it is the only one that causes this type of reproductive disease. These other trichomonads live in the GI tract normally, and they can contaminate our samples sometimes, but they're not going to cause the reproductive disease that we're concerned about. From the cow's perspective, with trick, it's important to remember that conception occurs and early embryonic development occurs. But then, just like Vibrio, we have inflammation and infection of the tract that then leads to fetal death. And you can see right here, these little embryos that have developed, but then the amniotic vesicle filled with white blood cells and inflammation, and that's what ended up causing that fetus, or that embryo to die. So the most common outcomes are embryonic losses. So again, we might have early embryonic losses where the cow might conceive, lose the embryo, she might cycle back again over and over again. We might have late embryonic losses where we get to this stage, she loses it, but then doesn't necessarily cycle back as fast and get rebred. And occasionally we'll have later abortions, but those are honestly pretty uncommon. So usually this is an embryonic loss situation. The cow does get a short-lived immunity, so she could clear the infection, breed back to that same trick-positive bull, conceive and carry that calf to term, and that does happen. But the immunity only lasts about 5 to 6 months after she's exposed, so it certainly won't hold her over to the next breeding season. So we ought to rely on testing the male. Again, we have just because it's easy with a preputial scraping, but we don't always test the female. And the reason we don't do that is it's not the most sensitive way to look for this in the herd. If we have a pyometra, so if we have a pus-filled uterus, we can feel when we're rectally palpating the cow, we can take a pipette in and we can actually get some of that pus and test it for trick. And that's an excellent sample. But without that, we are often worried that we're not getting a good sample of the cow. So when we do get any testing that to submit to the labs, an approved veterinarian needs to be the one doing the testing and submitting them to the lab or running them in their own clinics. We have a couple of different testing methods that I'm not going to go through really in detail, only to mention that as of October, we have a new test for trick that's become the standard for California. It's actually it's a way to replicate and amplify the genetic material that's present and really increase detection of very small numbers of trick in the sample. So we're really trying to target the bulls and the cows that might have evaded our testing in the past with this, and hopefully give some better results to everyone when we're doing this. So we'll rely on this reverse transcription quantitative PCR as sort of our new standard in the lab. As a reminder, there is no legal effective treatment for trick, which is really frustrating. There is a vaccination for cows. I don't work for Boehringer Ingelheim, and I hope no one here does, because I do want to say that it's not the best vaccine. But it is good when used in the right way. So when used before we expect exposure, so it needs to be used in the cows before the breeding window, so they have the highest level of immunity they can before they potentially are exposed to a bull that has trick. It won't prevent infection, but what it does is it hastens the clearance. So it speeds up clearance of that protozoa from the female's reproductive tract and lets her get back to a state where she can conceive. And if you look at a group of cows, a group of cows that was vaccinated with this, as compared to a group of cows that was not vaccinated with this product, will have a higher pregnancy rate at the end of the breeding season, all else being the same. So it works good on a herd level. It just doesn't prevent the infection in the individual cow. Okay. One thing that just to mention is that we do see fungal abortions that will cause a really thickened, nasty placenta, just like a bacterial infection would. But we also will see these plaques that form on the fetus's skin. It almost looks like ringworm, right? Because it's a fungal infection of the fetal skin and of the placenta. Often late-term pregnancies, most common we see this Aspergillus species of fungus cause these abortions. But really, unfortunately, there's not a lot to do to prevent this. They are sporadic, so that we don't see these in an epidemic situation. We see them randomly and occasionally. So it's unfortunate when it happens, but there's not a lot we can do to really prevent fungal abortions in cattle. All right, a few viral issues to be concerned about, and I'm going to mention BVD and IVR this evening. Real quick, there's a question that just popped up. Can replacement heifers be vaccinated for foothill abortion and brucellosis at the same time? And the answer is yes. We actually did a trial just to make sure that there wouldn't be any interference, and it is both safe and effective to do those together at the same time. We just recommend giving them on opposite sides of the neck, if possible, when we're doing that. If you can't do that, then at least spacing them out as far enough from each other so there's no local interference in the cow or the heifer. Okay, BVD, bovine virus diarrhea, causes a host of problems, one of which are reproductive causes. The naming and the classification can get confusing because we break it up into genotypes and we break it up into biotypes, right? So genotypes are the different genetic diversity that we see, all of which cause issues in cattle. The biotypes are really how that virus acts on cells, whether it kills cells or whether it doesn't kill cells. It causes diarrhea, causes respiratory disease. It suppresses the immune system, leading that animal more susceptible to other outside viruses and bacteria. And it causes a spectrum of reproductive disease. So looking at the 9 months of gestation in the cow, this is what BVD can do. If the cow is exposed and she's naive, never seen it before, and gets infected, in the first 2 months, we can see infertility issues, we can see resorption, we can see embryonic losses. We can see frank abortion and congenital effects happen through the first 2/3 of pregnancy. And in the late term, we can see an immune response without any kind of fetal disease. So we can see a relatively unaffected animal. The different manifestations are here. We can see changes in the brainstem. We can see changes in brain development in general. We can see spinal cord and neural deficits. We can see joints that are fused and contracted and can't flex. A whole host of problems because of the neurologic effects of this virus on the developing calf. One of the big concerns we have is this persistent infections window. So this happens if the virus is present while the calf's immune system is developing. And it's at the end of that first trimester of pregnancy. The calf can't tell that that virus is something foreign or different from its own cells. So it doesn't learn how to mount an immune response against it. What that means is that calf will go to term, be born, and be what we call a persistently infected calf. That persistently infected calf is like the typhoid Mary in the herd, right? It's going to be shedding and spewing virus out of every orifice and being a source for every other animal that comes in contact with it. So from a herd management perspective, it's a big concern. These calves are unthrifty, they don't gain well, they're more susceptible to other diseases, not something that anyone wants. And so we often diagnose them with an ear punch, right? Either an ear notch or an ear punch through a tag, doing a couple different special stains or tests on them that will detect the persistently infected calf and not be confused with an acute infection like they got exposed after they were born. In extreme cases, they can get what we call mucosal disease, where we have this PI calf, and then they're infected with a different strain of BVD that they found either in nature or were vaccinated with. And it causes what almost looks like foot and mouth disease. It just causes these horrible erosions and ulcers on the mucosa of the cow's nostrils and lips and esophagus and things. And it can be a pretty bad disease. Prevention, we have a lot of vaccines that include BVD, both type 1 and type 2, both modified lives and killed vaccines. We often see a more robust immune response when we use a modified live vaccine before pregnancy. But the killed vaccines do a good job too. And for future boosting of adult cows, killed vaccines can be quite good too. And you can see all these are going to contain bovine virus diarrhea. But if you look at the subtext, you can see what contains type 1 and type 2. Most are going to contain type 1, only a few contain types 1 and 2. But it's going to be a standard component anymore in most of our multivalent vaccines. The other virus I want to mention is just IBR, so infectious bovine rhinotracheitis. Causes things like red nose, causes pneumonia, causes a lot of reproductive issues as well. It's a herpes virus, so it's the cattle herpes virus that can cause massive abortion storms in otherwise healthy but naive cattle. So cattle that have never been exposed or vaccinated for this, and they see it, it can be pretty devastating. It causes pretty rapid fetal death. So once that fetus is exposed, it's going to die often within 24 hours. But it might not be passed or expelled for days or even weeks after that infection occurred. There's no fetal response to it, but it's going to be pretty devastating when it actually happens. We see a lot of fetal effects, so we'll see fetal liver changes and other internal organs in the fetus just by the nature of how herpes viruses tend to affect the developing animal, but something that we'll certainly test for at the diagnostic lab. We don't see it as a huge cause in California, but it does happen. I really do recommend that all cattle that are getting vaccinated get vaccinated for IBR. So many use care with modified live vaccines. And so you may have heard the warnings about using modified live vaccines in pregnant animals. It goes back to this IBR component here, because if you give a modified live vaccine that has IBR to a pregnant animal who has not had that same modified live vaccine before she was pregnant, then it can actually induce an IBR abortion quite quickly in those animals. So it is dangerous to use there. But when used properly, and if you follow the manufacturer and label recommendations, it can be used safely in pregnant animals is, again, as long as they got that same vaccine prior to pregnancy. Okay, I'm just going to wrap up with a few toxic plants of note. So again, we've talked about some infectious causes. We have many non-infectious causes, a few of which are toxic plants that we have in California. I'm just going to highlight a few things briefly. The loco weed, of course, is one that we will see. It has a pretty broad window for effects during pregnancy. And it seems that after cattle eat this, they almost seek it out. They almost like it when they go after it, but it can have a significant effect on reproduction. It does require chronic exposure. So it's not just a one-time deal, but chronic exposure throughout pregnancy. And we can see anything from altered placental development to abnormal calf development. And it's basically causing what we call an acquired lysosomal storage disease. So it's causing alterations for how nutrients and fat and other structures are stored within the tissues of the calf. And so it can even infect the ovaries and the corpus luteum that's maintaining pregnancy. It can do all sorts of have those interesting effects that eventually lead to abortion. Lupine, again, multiple colors in the flowers that can happen here. A couple different toxic components that tend to concentrate in the seeds. Affects cattle, doesn't seem to affect small ruminants that much. But when we have exposure between 40 and 70 days of pregnancy, it can cause a lot of congenital defects. So sometimes it's called crooked calf syndrome because of the way that the joints fuse and aren't able to move around. But it causes these abnormal calves, sometimes with these contracted limbs that are born, or you might have to have a C-section because they can't flex and stretch in order to be delivered in a normal way. And then pine needle abortion. Many different species of pine trees are known to cause this. Both fresh and dried needles are the culprits here. And the toxic component is one very specific thing called isopropessic acid that's found there. But it's not just from eating the occasional pine needle. I mean, cattle need to eat well over 5 pounds a day in pine needles for multiple days in a row to have enough of an effect. And what it does is this acid causes the blood vessels going to the placenta to constrict. And so we basically are reducing blood flow to the pregnant animal or to the pregnant uterus. And that's what causes that calf to die and be expelled. Occasionally it can cause just a weak calf because, again, it was deprived of normal blood flow in the last part of pregnancy. And sometimes after abortion, we'll see these retained placentas and metritis. So a concern, but again, they have to eat a lot of pine needles for a while to have this effect. But again, this can happen depending on how much they're eating within 1 to 2 weeks after they eat them to have their effects. And the last thing I want to mention in terms of causes, something that gets overlooked many times are genetic disorders. And there are many different genetic causes. Like I said, most chromosomal issues will take care of themselves during the early embryonic period. But there are some known genetic disorders in different breeds of cattle that can have calves go to late gestation or even to term and be born. And I have a couple of them here. All of these that I have here, there are genetic tests available that you can test calves for. If you're buying bulls or buying semen for artificial insemination, many of those bulls are tested beforehand, and they'll say them on the in the catalogs. They're tested free of curly calf or tibial hemimelia or pulmonary hypoplasia and anasarca. Because again, these would be causes of abortion, but they're not infectious. They're definitely genetically linked. So always something to keep on the back of your mind. And whatever breed you're running, knowing the common genetic disorders that have been identified and that are testable within that breed can be really helpful. So implementing vaccination protocols, just to mention, there was a question that already came up. First of all, if it ain't broke, don't fix it. So if you're not having issues or concerns, then I would keep things as they are. But if you are having concerns, then there are certainly ways to improve. Vaccination is one method to increase immunity before disease exposure. You cannot vaccinate your way out of other management issues. So if you're having a really muddy, dirty, wet calving area, like so many people are, or if you are having other problems in the herd, then there isn't always going to be a vaccine to solve that. But they are very useful when used appropriately. Vaccines should always be administered before your expected exposure, because if you vaccinate after the exposure, you're too late, right? So the whole idea is to prepare that cow for that disease. And we need to store vaccines, handle them, and administer them in the right way for them to be fully effective. Which might go without saying, but the modified live vaccines that we reconstitute are only good for about 6 to 8 hours after reconstitution. So you don't want to put the remainder in the fridge and use it the next day to vaccinate somebody else, because it will not be effective at that point. So specific diseases to think about, there are a lot of overlaps between reproductive and respiratory disease, luckily, but typically our core recommendations are IBR, BVD, leptospirosis, and Vibrio. If you're having problems with foothill, then incorporating foothill into your cat food vaccines. If you're having trick issues, incorporating trick into your annual vaccination protocol. There are many other diseases such as bacterial, pneumonia vaccines, and many others like pink eye and scours and things that I haven't listed on here. But for reproductive diseases, we have just a few core ones that we recommend. And there are a lot of products out there. Again, all the multivalent, both killed and modified live, they do work well. Some are better in certain circumstances, and that's where working with your veterinarian can really help pick out which product is going to be best. And again, the caution on using modified live vaccines during pregnancy if they've not previously been vaccinated with that same product, where it's that IBR component that can just induce abortion there. One last word of caution, labels are confusing, they're long, and they look the same. So again, I don't work for Elanco, nor do I work for a company that competes with Elanco. But if you look here, what's the difference between these two vaccines? Right? ViraShield 6 VL5 and ViraShield 6 L5. One contains Campylobacter or Vibrio, one does not. And the label looks exactly the same. And we've had outbreaks and abortions from Campylobacter in herds that have accidentally started using the non-Vibrio containing product here. So I just ask that you're just diligent about what product you're getting, making sure you're buying the correct one or receiving the correct one when it's shipped to you before you administer it. And with that, that's what I have to say. I see there are a few questions popping up here. Let's try to take these off here. When drawing blood to check pregnancy at 3 to 4 months, cows had a trace of color when we tested them. Can you clarify what you mean by a trace of color? Were you just doing the cow side, or the stall side tests there? So it might have been a weak positive. So if I'm thinking right. So in those cases, retesting there and they were open, they were likely either had losses before you tested them and the levels in the blood were just waning down and barely registering. And then when you confirm that, they were true negative. Those are the cases, yeah, if it's embryonic losses, trick or Campylobacter are my two go-tos to consider. There aren't toxic plants that I really know of that would cause embryonic losses. The ones that we've talked about, they really target a more developed fetus or blood supply that wouldn't have developed yet in the case of an embryo. Acorns, we do see an occasional acorn abortion. There are a lot of species of acorns, and there are only a few that have the gallic acid that's known to cause abortions. And so there's typically, I don't have it off the top of my head, but it's a fairly significant amount of acorns they need to ingest to actually cause that. But if they are grazing under oak trees of that particular species, they would be at risk. And other than changing where they graze, it's really hard to have any other management ways to to reduce their exposure. If a cow is a late-term abortion with foothill, will it have problems with the next calf? Typically not from foothill. So when a heifer or a cow that's moved into a newer area that's never been exposed aborts, she's been exposed and she's mounted a full immune response to foothill. And they should be good for the next year. We know that from some of the vaccine studies we've been doing that one dose of the vaccine, which mimics natural exposure, gives immunity for at least 3 years with nothing else happening. What we often bank on are those heifers and cows being in these endemic areas where they're going to be boosted every year from natural exposure to the tick. So we feel that once she's aborted from foothill, if she's still in the same environment for the rest of her life, she should not abort because of foothill again. She certainly could abort from another reason, so that's always something to keep in mind, but it shouldn't be foothill.
There was a question in the chat about foothill abortion also that you said it can be detected in the blood of the cow, and can you use that detection to determine if they've been exposed?
Yeah, so what we can do, it's like other blood work that we do. We can look for antibodies, so we can see if that heifer or cow has been exposed. So yes, we can use blood work to see if they've been previously exposed. And that can help us with trying to rule in and rule out that as a cause. We can also use it sort of as a sentinel testing if we think there's foothill in the area.
I think we should just mention, so I'm not sure, but I don't believe that you can just send blood to the calf's lab and require that test. So if you're interested in that, I think you contact them ahead of time to make sure that they can run this. So, don't just send the blood, contact them ahead of time.
Yeah, thank you for that. Yeah, to clarify, it's often done as part of an abortion workup, or in certain circumstances where you're working with your vet on a particular issue. But it's not set up to be a mass large-scale screening for them. There's talk about trying to ramp up the use of it and maybe use that in the future. But it's not something that's done right now, or they have the capacity to do like that.
There's one more question in the chat. It asks about if you see infertility in fully vaccinated cattle, specifically regarding lepto. So if the cows have been vaccinated every year since being young, does lepto still cause that infertility issue?
Typically, no. If there have been no other changes, then they'd likely be fine. If they're coming in contact with a new serovar or there's new exposures to something, then another type of lepto could be causing those problems. I would still be vaccinating. And if you are vaccinating and you're getting lepto abortions, that's where it's really important to figure out exactly which serovar of lepto you're seeing, and either altering the vaccine product you're using or altering timing of your vaccine to give you the best coverage. See a question about correlation of haylage and increased abortions. Well, if it's being stored improperly, we do worry about listeria. Not something that we talked about tonight, but it's a bacteria that can flourish in that type of storage. And certainly listeria ingestion will cause abortion. So yes, if it's being prepared improperly, or you have a lot of decomposing grass and hay around, like from a flooded pasture that receded, that acts in the same way, where listeria loves to grow and flourish in those environments. So yes, those can cause abortions.
Thank you to Dr. McNabb for sharing your knowledge on identification and prevention of calf abortions. During the video, there were references to other webinars. You can find recordings of those sessions on this YouTube channel. Thank you for watching this webinar recording that was brought to you by the University of California Cooperative Extension and University of California Davis Veterinary Medicine, and was co-hosted by University of California Cooperative Extension advisors Tracy Schohr, Grace Woodmansee, Rebecca Ozeran, and specialist Dr. Gaby Maier.